Okay. Okay. So when we start in on visible body, of course, and I'm not, you guys can watch this video on your own, of course. But anyhow, it's never know where to put that thing. Let's put it up there. So short video that goes through some of the basics of bone. Again, just an overview. Generally, when we start the classification of bones, we divide the skeleton up into two main categories. And these are a couple of terms that you've probably heard before at some point: axial and appendicular. So the axial skeleton, just like any axis, has to do with what all of the other bones kind of rotate around. So we think of maybe the axial bones as being down the center, down the midline of the skeleton. And that's certainly what we would see with the axial skeleton. We're thinking of the skull, vertebrae, and ribs. Okay, so the skull, the vertebral column, collectively the vertebrae, and then the ribs or the thoracic cage, that makes up the axial skeleton. Okay, and then when we look at the, so I'll click it, it'll kind of highlight it for you. You can see we've got skull, vertebral column, and ribs, or rib cage. It includes the sternum too. I should just say ribs, but call it the rib cage or the thoracic cage. So the appendicular skeleton, just like the name implies, would involve the appendages. And you've heard that term at some point, some sort of extra or an attachment or something, right? So the appendages. We think of the arms and the legs, but there are also a couple of other features that go along with the appendages. We look at Mr. Bones, and I'll kind of spin him around. We can see his shoulder blades and his pelvis are also highlighted in blue. So we call these two items the girdles. We call the most superior one, the shoulder area, we call that the pectoral girdle or the shoulder girdle. And that includes the clavicles or the collarbones and the scapulae or shoulder blades. Okay, so the pectoral girdle is also part of the appendicular skeleton. Okay, and then so we'll look at that more detail a little bit later. And then we have the pelvic girdle as well. We'll see that that is, in essence, three bones or three pairs of bones, in essence, are fused together. So we call these the coxal, C-O-X-A, bones, coxal bones. All right, so anyway, that's the first kind of, breakdown of your 206 bones. As well, we can divide them up into axial or appendicular. Why do we have, so then we'll talk a little bit about functions. Again, advanced A&P is primarily a 14-15 week adventure in function. So I don't want to spend too much time on function each week, but I do want to give you the basic functions of the skeletal system and of course of each system as we get to those. So certainly support and movement kind of going hand in hand. We see that the musculature, the skeletal musculature is attached to these bones, and it provides certainly the movement aspect across the joints. And then the support aspect. Without the skeletal system, we'd probably be a little puddle or maybe a big puddle on the ground. So that certainly, because of their dense and hard nature, we're able to have support of the entire body structure. We do see in some aspects of the skeleton protection of organs. Certainly, the skull is protecting the brain. We see the vertebral column protecting the spinal cord. And then certainly that thoracic cage or thoracic girdle is going to be protecting the heart and the lungs and some of that viscera. So we do see some protection of organs. Doesn't say it up there, but it's a storage unit too for minerals, like calcium storage is a big deal. Your heart, when we see in a couple of weeks, we look at muscle a little bit, we'll see that the heart relies exclusively on calcium regarding electrolytes. It's one of the big, I should say exclusively, it needs a few other electrolytes, but calcium is the big dog when it comes to making sure the heart is beating. So your body always needs calcium to keep the heart beating. If you're not able to consume it, you have plenty of it stored in your skeletal system. So it's a reservoir for calcium. It's also the site of red blood cell production. And we do see some other blood cells produced in bone, but we primarily think of red blood cell production occurring in bone. We'll look at bone marrow a little bit and see two different types of bone marrow and kind of what's going on with red blood cell production. And again, we spend a little bit of time next semester going through, they call it hematopoiesis, which is the production of blood cells. So anyhow, let's get into bone types a little bit. We'll go a little bit further with some of the bone classification. We also, in addition to naming all of these bones, we can classify them as one of five, being in one of five categories. And these are going to be based primarily on their shape. So we have probably the most commonly known bones would be the long bones. And long bones are just like they sound, they're going to be longer than they are wide. So we think primarily of the appendages as being long bones. So the humerus, ulna, radius, and then the leg bones, the femur, the tibia, and the fibula. Okay, so the primary long bones are going to be the arm bones and the leg bones. These are also what we kind of call the typical bones. So when we look at composite cellular stuff and kind of the marrow aspect and the kind of the basic structure of a bone, they typically will use a long bone as kind of the poster bone for analyzing kind of the cellular and the ins and outs of the bone. So anyway, the long bone. We have what are called short. If we have a long bone, we must have short bones. And short bones generally we would think of as being the wrist bones and the ankle bones. So the carpals and the tarsal bones. Not much other than that, really, with short bones. And then we have several flat bones. It just lists the frontal bone there, which is your forehead bone. But most of the cranial bones are going to be flat bones. In fact, most of the skull bones are considered flat bones. And then we'd see like the sternum is a flat bone. The ribs are considered flat bones. The shoulder blades, the basically your shoulder, your pectoral girdle and pelvic girdle, both of those are all flat bones. Your thoracic cage, so your sternum and ribs, as I mentioned, are also considered flat bones. So the long bones and the flat bones are going to be the most, they have the most bones under their umbrella there. Okay, and then irregular bones, we've got some that don't really fit into any category. So the irregular bones are going to be kind of oddball shape. And really, we just consider the vertebrae to be irregular bones. Notice the spelling too, real quick. As a side note, vertebra with an A on the end is the singular. If I put an E on and it's pronounced vertebra, it's one. More than one are vertebrae. So you put an E on the end. We'll see that in a couple other anatomical stops or pit stops. We'll see words singulars ending in A and plurals ending in E. Okay, so the vertebrae are irregular bones. And then lastly, we have what are called sesamoid bones. Sesamoid bones generally don't really articulate with any other bone. We oftentimes find sesamoid bones kind of embedded in tendon, kind of, embedded in other tissue. So we may not see those guys articulate with other bones. I mean, even the skull bones, they're fused together, but they're still connected with other bones. So in fact, we can consider those suture lines in the skull as being joints. But sesamoid bones don't really form a joint with any other bone. And we primarily would see named sesamoid, you want to always think of the patellae, or one is a patella. But the patellae or the kneecaps are considered sesamoid or floating bones. Okay, sesamoid bones or floating bones. You may, again, if you work in orthopedics, and even if you don't, if you're looking through a patient's chart and they have some x-rays in there, maybe of their hands, we see them occasionally in the feet, but oftentimes in an x-ray, we might find like an extra little bone kind of floating or swimming inside of some of the tendinous matter of the hand, usually in between the first and second metacarpals. So sometimes in an x-ray, we'll see a little bone bit that's just kind of grown. Usually they grow to kind of alleviate some, stress. Bone builds bone when there's more stress on an area. So folks who do a lot of repetitive use with the hands, they may develop, they're almost like bone spurs, but they're not really connected to any bone. A bone spur is actually off of is part of a bone. So it's a growth on a bone. Whereas a sesamoid kind of grows on its own, usually embedded in some sort of soft tissue. This provides harder support, basically. So, but anyway, you wouldn't know if you had one unless you got an x-ray of your hands or your feet. Well, we do label the patellae as sesamoids. We'll also see another bone in the throat area called the hyoid bone. It's kind of a floating bone. I don't really, there's debate on where it gets classified. Some say it's an irregular bone. It looks kind of like vampire fangs a little bit. So we'll see the hyoid bone coming up shortly. It basically anchors a lot of the ligaments that kind of keep your tongue in place and part of your voice box or your vocal folds. So we'll see the hyoid coming up shortly. And that could be classified as potentially an irregular bone or a sesamoid bone. And even more, it has a kind of a flat, curved appearance, so it almost looks like a mini rib too. So they don't really put hyoid in any of these categories. It's kind of uncategorizable, I guess. Okay, so again, the basic flat bones that we mentioned, the cranial bones, the shoulder blades, sternum, ribs, pelvic region are going to be as well. And again, your long bones, we'd think of the arms and legs. It's going through some of the bone names. We're not going to look at those quite yet. Anyway, the arms and legs we'd consider to be long bones. And even the hands and the fingers are longer than they are wide. So technically, the metacarpals, metatarsals, phalanges, those are your digits. Short bones, again, generally thinking the wrists and the ankles. And they classify the pelvic girdle as irregular bones. We learned that they were flat bones, so apparently that's changed over time. Again, I think it depends on the publisher, the author, or the anatomist. So there is some debate potentially to be had by those classifications. Now, Let's go inside of the bone and look at a few of the structural features that make up bone. Internally, we have what's called yellow marrow and red marrow. Yellow bone marrow is going to be what we see in adults, usually once you've stopped growing. So by the ages of 18 to 25 or so, your bone marrow of your long bones is going to convert from red to yellow. So always associate, first of all, yellow bone marrow with adults, and also associate it with making up the marrow cavities of your long bones. So all of that marrow in your arms and legs converts from red to yellow. Yellow implies fat too. Now, we do see under extreme situations, yellow marrow can convert back to being red marrow. We'll see it sometimes in chemo patients that occurs. But what is red marrow and where do we find that then? Red marrow we typically will find in flat bones. So the sternum, the skull bones or the cranial bones, the pelvic bones as well. We also find red marrow, and it doesn't really show on here, but at the ends of those long bones, so kind of up where the humerus meets the shoulder area, and then where the femur meets the hip region. So the ends of your bones will also tend to find some red marrow throughout your life. So from 0 to 18, all of your bone marrow is red marrow. And then there's a transition that starts occurring around 16, 17, where some of that red marrow of the long bones converts to yellow. You retain red marrow in the spongy bone of the rest of the skeleton, as well as at the ends of your long bones. Red bone marrow is responsible for, or is the site of red blood cell production. So red blood cells, we'll see later in more detail, only have a lifespan of about 120 days. So you're constantly producing red blood cells till you die. Okay. And that occurs with red marrow. So when they do bone marrow transplants, they go after the sternum or the hips to extract the bone marrow, because yellow marrow is not of use for the recipient. Okay, so red marrow, you want to associate with red blood cell production. You want to associate that with the flat bones as well as the ends of your long bones. Here's an inside look at a bone and kind of some of the special features. Okay. One thing, and they don't have it on this particular slide, but the covering of the bone, and we looked at this, I believe, last week when we were going through tissues a little bit. There's an outer covering we call the periosteum. And again, we'll see it coming up here shortly, but I do want to make mention of that. The bones are covered in periosteum, kind of a tendinous sheath. And the periosteum is, in essence, an extension of or a connector of tendons. So the tendons of your muscles kind of mesh together and form and become part of the bone via that periosteum. So it's very difficult to detach a tendon from a bone. It happens, certainly, but it is difficult to do. So the most superficial layer, and this talks about the interior of a long bone, but I do want to mention that a couple of these features occur in all bones. Okay, all bones are going to have that periosteum around it, around them, and then that next layer. So really, the most superficial layer of actual bone is called compact bone. So the most superficial layer of bone is called compact bone. And you can imagine just by the name that we have some densely arranged and / compacted cells. Okay, so compact bone makes up the outermost layers of really any bone. Now, when we go in a little bit deeper, we start to see some what we call porosity, or some holes a little bit. You can kind of see it's shadowy there. You can see these grooves there. You can start to kind of see it here, where it becomes more porous. You can see this outer rim, or this outer edge here. That's going to be compact bone. And then the spongy bone is going to be the deeper layer. Now, if we're at the end of a bone, we see a lot more spongy bone than we would see in the shaft, or what we consider to be the diathesis of a bone. Okay, so know your layers, superficial to deep. Superficial is going to be the periosteum, and then the compact bone, and then the spongy bone. Now, when we'll look at a short bone, or an irregular bone, or a flat bone, and they're primarily going to be composed of that spongy bone. Now, spongy bone, which again is more porous, found at the ends of long bones, as well as within all other types of bone. Spongy bone is the site of red blood cell production. So this is where you're going to find red bone marrow, in spongy bone. Okay, red marrow in spongy bone. Forever, until you die. Now, in long bones, we have a specialized feature called a medullary cavity. Medullary cavity. So this is our first kind of difference between a long bone and all other bones. All bones have some superficial compact bone, and then some deeper spongy bone. But only long bones are going to have this medullary cavity. It's also referred to as simply a marrow cavity. The medullary cavity is also the marrow cavity. This is where we find the red, like a large amount, a very concentrated amount of red marrow, until we're done growing. Once we finish growing, this is the marrow. This red marrow converts to being yellow. So this, technically, this particular bone we're viewing would be a bone of someone who's not done growing yet, because we have red marrow in the marrow cavity. Okay, so red marrow in the marrow cavity means that we have someone that's still growing. Once you stop growing, this converts to being yellow. All right. So a couple other items of interest that we want to see or take a look at regarding bones and bony landmarks. We're still looking at a long bone, but I want to mention the ends of the bone versus the shaft of the bone. The ends of the bone have a specific name. And again, this would be for a long bone. This doesn't apply to short bones or flat bones or irregular bones. This only applies to basically the three upper appendages and the three lower appendages. So the humerus and the ulna and the radius, and then the femur, the tibia, and the fibula. But anyhow, we have two different ends. We have what's called the proximal end and the distal end of the bone. And remember, when we talk about proximal and distal, we're generally focused on appendages for starters. Well, here they are. We're back to proximal and distal, and we're looking at appendages. Remember, proximal means we're closest to the site of attachment to the body. So proximal end of a long bone is going to be the closest end of that long bone to the body, in essence, to where it attaches to the body, and even more descript, closest to the shoulder or closest to the hip. if we're dealing with one of the lower appendages. So the proximal end of a bone, again, is going to be the end of the bone that's closest to where it attaches to the body. So the distal end is the further end of the long bone, further from its site of attachment. Now, end of the bone is not sciencey enough, so they give it the term epiphysis. E-P-I-P-H-Y-S-I-S, epiphysis. Remember, epi as a prefix means upon something. So all long bones have two epiphyses. They're going to have a proximal epiphysis and a distal epiphysis. The shaft of the bone is known as the diaphysis. Dia, D-I-A. Diaphysis. That's the fancy word for the shaft of the bone. And in the diaphysis, again, that's where we would find the marrow cavity or the medullary cavity. You can see this particular bone that they're showing has yellow marrow, so we must be looking at an adult long bone. All right, so a couple of things that we see on here that may be a little bit new, in addition to the epiphysis or the epiphyses and the diaphysis. So real before I move on, again, proximal. So we look at this. This is the femur, could be the humerus too. The proximal end would be what forms either your shoulder or your hip. The distal end would be what forms your elbow or your knee. All right. So this outer covering, again, there's the term there, periosteum. Okay. And then remember, just under the periosteum, we're going to have a layer of compact bone. And again, that layer might be really small, especially at the epiphyseal region, the ends of your bones. The compact layer is pretty thin, because then we get into the spongy bone. And again, we don't really see much in the way of spongy bone at all when we're in the diaphysis or the shaft. Okay, so periosteum's the outer layer, then compact bone, then spongy bone. And then we see kind of an inner lining called the endosteum. Endo as a prefix means inside of or in, like entering. Okay? Endo means inside. So inside the bone is endosteum. Outside and around the bone is periosteum. And then we also notice we've got a couple of blood vessels. Remember, blue always signifies the blood that's low in oxygen, typically venous blood, and red always symbolizes blood that's high in oxygen, typically referring to those as being arteries. Again, we do have a couple of exceptions that we'll see later on. Okay. Blood vessels, that's good, right? We need blood vessels going into and out of bone. That's where the red blood cells are produced. So how are we going to get red blood cells out of the production facility? Well, we need some sort of tube or tunnel, so we've got blood vessels. We also need to feed bone. So some of these holes in the bone are for nutrients. They call them nutrient arteries. So it's groceries in. Sometimes it's groceries out, right? If we're delivering red blood cells out. Okay, one other item that we see, especially when we're looking at long bones, we'll see what's called an epiphyseal growth plate. You've maybe just heard of it as a growth plate. Okay. The epiphyseal implies that we're dealing with the ends of bones. Okay. Remember, epiphyseal means end of bone. So, anyway, we'll see. Again, this semester we don't do a heck of a lot with it. You'll go through it briefly. You'll maybe have a few questions about what we call ossification. Ossification simply means the production of bone, bones hardening. So when the baby is in the womb, their skeleton is made of cartilage, and as they start to get closer to 40 weeks, their parts of their skeleton become more ossified or hardened. And then as they grow, and certainly as we grow, our bones eventually become completely ossified. And we have what are called primary and secondary ossification centers. So the primary center is going to be the shaft or the diaphysis of the bone, and the secondary centers are going to be the ends of the bone. And where the primary center meets with the secondary center, that's where we're going to have these epiphyseal discs when we're still growing. The discs are cartilaginous. And if those are injured or damaged, or somehow a fracture goes through an epiphyseal disc, it could inhibit the growth pattern of that child's long bone. So that's a big thing when we look at x-rays. We want to see, certainly in children, where that break has occurred. Because if it does go through an epiphyseal disc, then again, it could inhibit some of the growth patterns for the future of that bone. Once the bones have ossified, we're left with a line or a plate. Epiphyseal line is kind of the remnant of those ossification centers. Okay, we've seen this. We saw this last week when we looked at bone tissue. It's a little more detail of these osteocytes are mature bone cells. So on the cellular level, we see three types of bone cells. Osteocytes are the mature bone cells. Osteoblasts are the babies, and osteoclasts are the chiselers. They're the ones who basically kind of model the bone. So blasts build more bone, clasts model or chisel that bone that's being built. And then once these guys have matured enough, they've done enough grunt work, they move up the ladder and become an osteocyte. They become a mature bone cell. We see several different canals and little tubing centers going through those canals. Again, very vascularized. Bone is very vascularized. Okay. Each of these little rings is going to have a central canal carrying blood supply. And then off of those central canals, we might see what are called Haversian canals. We'll see what are called perforating canals. Canaliculus just means little canal. It kind of connects everything. Anyway, little bone histology. Osteons. I believe this is in this image. I think I put in your unit 2 identification stuff. Again, osteoblasts are building or synthesizing bones. Osteoclasts are breaking down bone. So if the body is short on calcium, or the heart's lacking calcium for some reason, osteoclast activity will increase and cause calcium to, in essence, get released into the bloodstream. All right. So the next little section that we go through, I want to get out of this one. Growth plate. Yeah, this gets into some of the physiology that we'll look at a little bit next semester. Fractures, a couple different types of fractures. Again, we're, I'm just going to touch on this. If you take a pathology course, you'll have to know some of these. If you get into orthopedics or maybe surge tech or physical therapy assistant, you would need to know more specifics about these types of fractures. But we do have open versus closed. A closed or simple fracture doesn't break the skin, and whereas a compound or open fracture, we see the bone breaking through the skin. Certainly, we're more interested in, if a fracture comes into the office, having a simple fracture, they're easier to set. Healing time is a lot faster. This could be deadly depending on the artery. If this is, especially if it's, one of the main brachial arteries is right in this area. If this open or compound fracture goes the other way, it could shred the main artery and they could bleed pretty heavily. So these are definitely a problem and need to be fixed immediately. Green stick fractures, just kind of like they sound, they have a little bit, they're kind of like a hairline type fracture where you'll have portions of the bone kind of breaking or cracking up through the shaft of the bone. So maybe more of a longitudinal break than a horizontal break like we see with a closed. Comminuted just means we have multiple fractures. We'll see this oftentimes. So these are like a when you hear a bone is shattered, this is what we're talking about typically. We'll see this a lot with hips, with a broken hip. Grandma comes in and it's usually looks a lot like this. It's in pieces. So then we just basically get rid of all of it. We put a prosthetic pin in there. Yeah, this would be a rough one, right? This would be pins and screws and immobilizations, and then impacted, just like it sounds. You've got a break like a close, but we have the continuation of an upward force. So it's in essence pushing this proximal area down into the distal area. That's a rough one too. That's usually we'll see this from a fall of a height, maybe like a tibia bone going up into the portion of the tibia, or someone landing from a fall and getting an impacted fracture. But there doesn't show. We have what are called evulsion fractures too, where kind of like a chunk of the bone comes off, or where the tendon attaches to the bone. You'll see that a lot. Wrestlers will come in and or football players are landing and blowing out a tendon. They bend their hand so far back that it detaches the tendon from the bone. So you get those don't feel very good. Bone repair, again, we do this a little bit in advanced. Okay, same with this. And you'll have a few quiz questions on these, and it's okay. They're not to punish you or anything. They're simply just to introduce you to some of these concepts, because these are more physiology concepts, how we get what's called calcium homeostasis or calcium balance to occur. And again, what glands or what hormones are involved with that. So when we go through the endocrine system here in a couple weeks, we will see thyroid and parathyroid glands playing a major role in calcium homeostasis. You maybe heard of osteoporosis. It just means a condition of bone becoming porous. So we can see again kind of the medullary cavity and the shaft of this bone having quite a bit of spongy bone layer with it. And then we come over here and we see a lot of the trabeculae, or these plates of the spongy bone, have dissolved or become porous. So bone density decreases, and so we have problems potentially with some basic support mechanisms. All right, so those are the basics of bone and how we kind of organize bone. So let's see. You guys, the rest of this goes through some of the basics of bone naming. So I want to go through a couple of these items, and then I want to let you guys pretty much do what you need to do. Again, the axial skeletons first. So I'm going to go through the axial skeleton and a couple of items today, and then that's it. And you guys can work on the bones, work on your visible body, do whatever you need to do. And then next Tuesday, when we come in, I want to pick up on the appendicular skeleton, so you can absorb some of that stuff, and then talk a little bit about joints. So this week, really, your goal is going to want to be to have a decent grasp on some of the basics of what we just got them going through. and then adding to that some of the names of the axial bones. So again, the axial skeleton is going to be the skull, including the cranium and the facial bones, as well as the vertebral column and thoracic cage. So again, when we look at the skull, we divide it into cranial and facial. The cranial aspect is going to be what is going to contain and protect the brain. So again, you guys you'll want to go through these, and again, don't forget to click on the bone and it'll pull it up, highlight it for you. And again, if you have a touch screen monitor, you can move it around that way. If you don't have a touch screen, you can use your arrow up, arrow down, arrow over, and you can get different viewpoints of the bone. And the other thing you want to remember too, if you want to see just the bone, you can hit hide others or fade others. So you can hide all of the bones. You can fade them so you can kind of see inside of what's going on inside of the skull. So occipital bone, the other thing I wanted to mention too, as you go through these, you'll notice some bony landmarks as well. And they may label them later on, and that's fine. But again, I don't want to bog you down too much with bony landmarks. A bony landmark is going to be a hole in a bone, a bump on a bone, a groove. Most landmarks are either a bump or a groove. A lot of bones have bumps that fit into other bones that have grooves. Okay, so we name these bumps and grooves. A lot of bumps also are muscle attachment, tendon attachment, ligament attachment sites. So when we talk about bony landmarks, that's generally what we're thinking about. We're thinking about joints, okay, where two bones come together. So we'll look at bony landmarks a little bit next week. But for now, I really just want you to become comfortable with and familiar with some of the basic bone terminology and bone locations. So the base of the skull and the back of the head is the occipital region. So that bone happens to be the occipital bone. And then we have two parietal bones. The other thing with the cranial bones that you may want to notice or make note of are these jagged lines. And again, we'll talk about them more next week because these are considered joints. A joint is where any bone comes together with another bone. So we see the occipital bone coming together with the parietal bones, that forms a joint. We see where two parietal bones come together at the crown of the head there. That's considered a joint as well. So they're called suture lines, but they are considered joints. And we'll go through those, like I said, next week when we discuss the specific joints of the body. The temporal bones, you have two of those, right and left temporal bones. Those are going to contain your ear holes and your the bump, that big bony bump, or we call it the mastoid behind the ear. Okay, so there are some, as well as where the TMJ, you can see where the mandible, the jawbone comes in right here. This is the TMJ, or temporal mandibular joint. You can also see part of the temporal bone forms the cheekbone, or kind of comes together with the cheekbone. So the temporal bone, if I hide all the other bones, it's a pretty oddly shaped bone. It's got a lot of little holes and little bony landmarks. There's a sharp little process right here. There's a big bump here, a big hole here. There's a groove here for your jaw, and then this little spike connects with your cheekbone. So yeah, the temporal bone, probably one of the more fascinating and maybe complicated bones of the skull. And the frontal bone, that's just a fancy word for the forehead. And frontal bone, and you can see it forms a joint with these two parietal bones. So we'll name that suture next week as well. And then we have the sphenoid bones that make a little bit of an appearance, but the sphenoid bone also, let me fade everybody here. The sphenoid bone also forms, along with the occipital bone, kind of the floor of the skull, particularly the kind of more the anterior floor of the skull. Okay, so you have the sphenoid bone, also a very interesting bone. It looks like a bat or a butterfly, so they call these the wings of the sphenoid. It looks a lot like a butterfly or a bat. The wings of the sphenoid. The sphenoid comes up later on too when we discuss the pituitary gland and where it sits. We'll look at this little kind of groove right here of the sphenoid bone. By the way, too, we'll see sinuses coming up later on, and the frontal bone and the sphenoid bone both have sinuses, little air cavities. And then we have the ethmoid bone, a very small bone that makes up the complete anterior floor of the skull. And it also makes up the ceiling of part of your nasal cavity, the ethmoid bone. The ethmoid bone is porous. It has little pores up at the top of it where we see the olfactory or scent molecules passing through. All right, there's where it starts to get into bony landmarks. Again, you could look at some of those if you'd like. You don't want to get too neck deep in those. If you're not comfortable with the occipital bone, you don't want to start adding landmarks. But if you are comfortable with understanding the basics of the occipital bone, there are a couple landmarks that are good to know. Like this, the largest hole in any bone of the body is here. It's called the Foramen Magnum. That's where the spinal cord leaves the skull or leaves the brain and the skull. You have little bumps here called condyles. That's where the first cervical vertebra is going to articulate with the skull. We have a couple little bumps up here. And again, these are primarily going to be attachment sites. But anyhow, you can go through those if you'd like. It just goes right back through all of the bones we just did of the cranium and talks about some of the bony landmarks. Okay. This slide goes through the sutures of the skull. We looked at the posterior back of the skull. We saw the occipital bone and then the two parietals. That forms what we call the Lambdoid Suture. Lambda is the Greek letter L, so it kind of looks like an L on its side. The top of the skull, where the parietals meet, is called the Sagittal Suture. Right down the midline, the mid-sagittal plane is the Sagittal Suture. And then in the front, where the frontal bone connects with the parietals, we have the Coronal Suture. And then finally, where the parietal meets temporal, is the squashed or flattened suture called the Squamosal Suture. So anyhow, you've got 4 primary sutures. We'll look at those in a little more detail next week when we study joints a little bit. This term fontanelle, that's probably, the details aren't necessarily that important for you right now, but knowing the word fontanelle and relating it to the soft spots of a baby's skull, right? So when a baby's born, their skull isn't fused, which is a good thing. It helps with the natural birth or delivery. And then the facial skeletons, the maxillae, going to be the upper jaw, if you will, the upper portion of the facial bones, more superior, the upper teeth, I guess you'd say, fit into the maxilla bones. You also have sinuses in the maxilla bones. So we'll see later on there are 4 primary bones with sinuses in them. So the maxillae, and then 1 mandible or jawbone. You can see where the mandible fits in over here with the temporal bone. We call that the TMJ, temporal mandibular joint. Some of your patients may come in with TMJ disorder. They've got maybe a clicky jaw, or they grind their teeth. They may have headaches. Call it bruxing, and they kind of grind their teeth. So yeah, I mean, we saw the temporal bone a little bit ago, and you know, it's where your ear hole is right behind or just posterior to that TMJ. So some folks with TMJ disorder, they present kind of ringing in the ears, ear popping, different things like that. And like I say, they'll get temporal lobe headaches, maybe. Their jaw will pop when they open it or close their mouth. Zygomatic, that's a fancy word for cheek. So those are the cheek bones, zygomatic bones. You can see they connect with the maxilla, and then in the posterior area, they connect with the temporal bone. That forms the cheekbone. This is called the zygomatic arch right here. You can see when we look at a superior view, you can see there's spacing there. That's where one of the main muscles for chewing starts up on the temporal bone and travels down past and through this little space here, and then connects onto the jaw or the mandible. Some animals, you know, that have to have a lot of bite power, or like alligators, lions, pit bulls, they have enormous zygomatic arches because the muscle that passes through there is enormous. So you can tell a lot about an animal's diet and what it consumes based on its facial and jaw features. And then it goes through some of the landmarks for the maxillae, mandible. I have a couple other kind of small oddball facial bones. The palate bones or the palatine bones. Those are going to be at the roof of the mouth toward the back. Most of the roof of your mouth is maxilla, but as you travel posteriorly, you'll hit what's called the palatine bones. And then you go a little further, and then we hit what's called the soft palate, kind of where that little dangly thing hangs in the back of your throat. Okay, the palatine bones. Lacrimals next, that means tears. So you have little tear ducts in the lacrimal bones. Those are going to be just behind or posterior to the maxilla, and then the nasal bones. The nasal bones are the bridge of your nose. And then we have what are called conchae. These are little bones inside of the nasal cavity, provide extra surface area. And then vomer means plow. So this looks kind of like a plow. This forms a major portion of your inferior nasal cavity. It's kind of like the bony septum of the nasal cavity. You can see, maybe see, there's some soft tissue above it that forms the soft tissue septum. Okay, we have a couple of other bones of the skull. They're the 3 smallest bones of the body. They're the auditory ossicles. Ossicle means little bone. So they call them the hammer, the anvil, and the stirrup. The fancy words are malleus, incus, and stapes. Malleus, think of like a mallet. Like the word mallet means hammer in Latin. So malleus means hammer. Incus means anvil, stapes, stirrup. So these are 3 tiny, these 3 ear bones are, they would fit inside of a peanut M&M, maybe even small. They may even fit inside of a regular M&M, but I don't. They're a little bigger than the inside of a regular M&M. So they're like the size of a peanut, all 3 of them together. They're not very big. I don't know if I have any. I think I have some at Burlington. I'll look around. I might have some ear ossicles in plasticine that you can see. Tympanum, that's the eardrum. So when sound waves come in, they vibrate that tympanic membrane or eardrum, which is where the malleus is attached to, and it causes the malleus to vibrate the anvil, which then vibrates the stirrup. And then that sends sound waves over down to the cochlea. So we do a whole section on the senses here in a couple of weeks. This talks about some of the holes in your skull. The bones of the eye socket is called the orbit. So there are 7 bones for each eye socket. And again, we've already gone through them: the frontal, sphenoid, zygomatic, maxillopalatine, ethmoid, and lacrimal. And again, there's that septum. This is the vomer bone making up kind of the base of it. And then the ethmoid making up the roof or the superior version, and then cartilage making up the bulk of your nose and that nasal septum. Okay, the hyoid bone, that's that one I mentioned earlier today that looks kind of like a pair of vampire fangs. Let me hide everything. So you can see there's what the hyoid bone looks like. In a horseshoe shape or U shape with little kind of points on top of it. And those again are going to be anchors for different ligaments and tendons. Yeah, that's right near where we swallow, as well as where our voice box is. So the coroner, the medical examiner more specifically, they look for dislocation of the hyoid bone when we're trying to figure out if it was maybe death by strangulation or something like that. Someone is strangled or choked out and they die, this hyoid bone is always going to be displaced. If they died accidentally from asphyxiation or like smoke inhalation or something like that, then the hyoid would still be in place. All right, almost done, and then you guys can have at it. Vertebrae. So the vertebral column comprised of vertebrae, including the sacrum and the coccyx, which are fused vertebrae at the bottom. So the inferior most aspects of the vertebral column are going to be fused vertebrae. So the sacrum, which is basically going to help form or combine your pelvis, are going to be fused vertebrae. Looks like roughly 5 fused vertebrae there. And then the coccyx, that's the fancy word for tailbone. So we see the coccyx is a remnant or vestige of the tail. And then all the rest of these are vertebrae. We have 24, let's see, 7 plus 12 is 19 plus 5. We have 24 vertebrae that are not fused. The first 7 vertebrae are called cervical. So we'll take a peek at those in just a few minutes. A couple of basic features of a vertebra. We have the body of the vertebra. That's going to be the more anterior aspect or toward the front. The portion of the vertebra that we can palpate is called the spinous process. And then just lateral to both of those, we have what are called transverse processes. These over here. We're not going to look at or get into this much right now. Spinal cord, arachnoid mater, dura mater, pia mater. We'll look at this here in a couple of weeks when we study the nervous system. Ligaments connect and provide stability between all of your vertebrae, the unfused vertebrae specifically. And then in between each vertebra, we're going to see intervertebral discs. And then coming out in between each of these, we'll see what are called spinal nerves. Okay, so let's zoom through these. Again, you can do you'll do these on your own. Also, if you watch the video, see, course YouTube channel. So if you go into the course YouTube channel, there's also skeletal system intro, axial appendicular skeleton division. So you can watch those too. I go through some visible body there as well. Okay, so if you're anyway, so zip through these 7 cervical vertebrae, and the first 2 are called the atlas and the axis. And again, to remember those, atlas comes before axis in the dictionary, right? AT comes before AX. So atlas is C1, axis is C2. The C means cervical, and then the number after it is the which one. So C5 would be the 5th cervical vertebra, etc. Okay, so you have 7 cervical vertebrae. The first 2, again, are specialized, called the atlas and the axis. All cervical vertebrae have these extra holes. So if you were just given one vertebra and said, or and asked to identify, is it cervical, thoracic, or lumbar? Cervical are the only vertebrae that have 3 holes. Okay, so cervical vertebrae have 3 holes. The other, thoracic and lumbar, they're just gonna have one vertebral foramen, one right and one big one here. They're not gonna have these other 2. Okay. Those are called transverse foramen. A foramen is any hole in a bone. Foramen. Foramen is any hole in a bone. So this large one is called the vertebral foramen, and then lateral to that we have what we call the transverse foramen. So that's one way to identify or differentiate a cervical vertebra from any other. Okay, and then the thoracic group. So you're going to have 12 thoracic. 12 thoracic. So again, notice when we look at this thoracic, first of all, it looks kind of like a giraffe head. You'll see the lumbar, they look kind of like a moose head. You see that? A giraffe looking head. Little horns on top. Okay. So notice just one hole. That's a thoracic. Yeah, and the other thing too, the body, this section, this is the anterior section, the body portion, this is going to get larger in diameter as we go inferiorly. So cervical bodies are small relative to thoracic bodies, which are medium, and then lumbar bodies are going to be the largest. And then the lumbar spine or the low back, it's a little more like a moose head or something. Anyway, you can see the body of a lumbar is much larger. And again, the sacrum and the coccyx we looked at a little bit ago. Those are fused vertebrae. And then lastly, sternum and rib cage. We'll do the sternum first. The sternum is broken up into 3 sections. We have this small section up on top. That's called the manubrium or the superior aspect. So we'd see the first rib pair articulating with the manubrium. The bulk of the sternum is comprised of the body. Okay, the body. And then lastly, at the bottom or the inferior aspect is this little point called the xiphoid or xiphoid process. Now ribs, we have 12 pairs of ribs. Okay, so we have 24 ribs total. The first 7 pairs are called true ribs. They're called true ribs because they have their own attachment to the sternum. So you can see first, second, third, fourth. The 5th pair has its own attachment. Here's the 6th one, comes in, has its own attachment. And then here's the 7th pair, comes in, and it has its own attachment. So these first 7 pair are called true ribs. And then the last 5 pair are called false ribs. We can see 8, 9, and 10 all kind of combine into one little batch there. And then 11 and 12, those are false. They don't have any cartilage. So they also refer to the last 2 pairs as floating ribs. That's it. So next week, so the rest of today, you can do whatever you want. You're free to do whatever you need to do. You can take a break. You can work on visible body stuff. You can look at the skeletal system and the bones.